As the COVID-19 pandemic continues, the global death toll is still rising at different rates in different countries. Looking at this chart raises interesting questions. For example, why does a tiny country like Belgium have a much higher death rate than Germany? Or how does Turkey keep its death toll lower than other countries? Even though Turkey is the 7th most affected country in the world, the death rate remains low, hovering around 2%. Of course, it's not easy to track the mortality rate during a pandemic. But the government took measures immediately after the first case was detected on March 10, and this seems to have helped Turkey's fight against COVID-19. We expect fatalities to be less than the world average due to the strength of Turkey's healthcare system. In Turkey, recent investments in healthcare like centralized hospitals have increased bed capacity, giving the country around 46.5 ICU beds per 100,000 people, a higher ICU bed capacity for 100,000 compared to most European countries, China and the US. Physician capacity is higher than the world average, and the government is adding a further 32,000 new healthcare professionals to fight the virus. Healthcare is free to all citizens and residents, so these facilities are accessible to all. Turkey also has 17,000 ventilators, and the domestic production of ventilators have been ramped up, reaching a production capacity of 5,000 new units per month. Since the emergence of the first coronavirus case in Turkey, more than 750,000 tests have been done. At the beginning of the outbreak, tests were only done to patients who came from abroad or had contact with infected individuals. But later, anyone who shows symptoms of the virus began to be tested. This is a massive increase in testing, which helps the early diagnosis. In the first week, only 2,000 tests were done, whereas now around 40,000 tests are being run on a daily basis. Computerized tomography imaging is one of the securest ways to detect the virus, and Turkey has invested heavily in this technology. There is an app called Hayat Eve Sağır Live Fit in your home, which is designed to help early diagnosis. It has an online coronavirus test. If you display symptoms, it directs you to the nearest hospital. You can also use your location to get information on how risky your neighborhood is. Having the testing, treatment and medicine free of charge is another major part of early diagnosis, because this way people don't shy away from going to hospitals. Turkish Health Minister Fahrettin Koca has also emphasized that contact tracing has helped to manage the breakout. But what is it exactly? Whenever a person tests positive, they are registered in a central health management system. Then all the people he or she have been in contact with are registered in the same system, and the tracking starts. The Ministry of Health has created 4,600 teams across Turkey to track and test potential carriers. Those who have come into close contact with an infected citizen are advised to self-quarantine and are being closely monitored by the teams to prevent contagion. Turkey has created a unique treatment methodology by giving medication to all COVID-19 positive adults, to even those with only mild symptoms. This approach, which many other countries haven't been using, has helped patients from deteriorating. The need for ICU units therefore decreases, and so far there has not been any overcrowding in Turkish hospitals. Gaining a better understanding of the true death rate will only be possible once the pandemic is over, but for now, the efforts of those who are fighting the disease here and all around the world deserve our deepest gratitude.